saying. I only have 5 minutes, got to talk fast. I'm a psychologist. I've been a psychologist for about 30 years. I started when I was a mere child. But in the 30 years that I've been seeing patients in all kinds of settings, to quote the Hamilton theme that we've been at, there are a couple of fundamental truths that I've seen that I think are true of all people. Number one, people think. Number two, people feel. Number three, people act. And number four, people live in the context of their lives, meaning they mean in communities. They live in, they have religious affiliations or not. They have friends or not. They are isolated or not. So understanding all these things make up what a human being is. When somebody comes to a healthcare event, they're bringing all these things with them. And think about it like this. When you go and you get diagnosed with something, and let's assume that this is in an insured world. I'm over. You have these things you bring with you. Number one, you have to know about all this medical stuff. You have to think, right? Number two, you have to know about all this insurance stuff. Then you really have to think, because that's really complicated. Number three, you're going to have natural, normal feelings about everything. And these feelings can sometimes drive your decisions much more than you think. And number four, you're going to live in the context, and they bring their context with them. And what Umair is going to talk about is what the context is all about. Treja.
So the understanding of importance, the importance of understanding context is not only something that feels right, but it's also something that makes financial sense. Dr. Saul Wiener and Alan Schwartz from the University of Illinois at Chicago have found in a study that when a physician doesn't account for a biomedical issue versus not accounting for a contextual issue, a real life issue that's preventing someone from getting the care that they need, that contextual error is actually more than 7 times more expensive than not accounting for a biomedical error. And that's part of the science that we've used at Accolade to think about how do we understand patient context to help deliver the right sort of support so people get the care that they need. Now that sounds fancy, but the model is actually very simple. It's built upon the premise of listening. What someone does to understand context is to, number one, pay attention to red flags. Red flags are those hints that someone is experiencing a barrier to care. Did you get your glucose test that you should be getting when you're about 28 weeks pregnant? No, I didn't. That's a red flag. The question, the natural, normal human question in that situation is, why? So you probe. After following a probe, it's like a flower that starts to bloom. The individual that's providing care can start to lay out a contextual plan that says, let's work around that contextual issue that's preventing you from getting the care that you need. When we've done this at Accolade and providing a health assistant model of support that brings together compassion, science, and technology, we found that our Accolade health assistants can probe at a rate of approximately twice that of what physician providers are able to do. As they do that, they're able to build contextualized care plans nearly 83% of the time that they have the opportunity to do so, versus just shy of 70% for physicians. What that means is that for Accolade, we find that patients, normal everyday human beings, are actually experiencing or displaying these red flags on the order of 1 to 2 times per healthcare visit to a provider's office or an interaction with an Accolade health assistant in our world. What that means for Accolade is that in the course of in any given year, we see tens of thousands, probably 200,000 plus red flags or opportunities to build contextualized plans of care. And since our founding, we've seen easily more than 2 million of these types of opportunities. And these types of opportunities are incredibly diverse, spanning issues of support, emotions, et cetera. And so it's really important that people listen to build contextualized plans of care.
So one of the things we've tried to do, and the reason we're here, is because we've tried to take this and build it into technology. Specifically, mobile apps, several apps, mini apps, those kinds of things. And one of the things we found that we want to share with you are 3 more fundamental truths that were true for us as we were exploring. One is that it's not an either or. You don't, there's been a lot of talk about looking empathetic and all that stuff. You have to address a human as whole, and that means the way they think and the way they feel. The other thing is that you have to be in their world when they need it. right? You can build the best app, but if you're going through 16 different screenings to get there, it's going to be really hard, and you're going to miss the poor mom with 104 temperature in her 6-month-old. And finally, what we would encourage you to do is not do either or, but put them all together. So what we're trying to do is put together our high-touch concierge service with application and digital information and where you can self-serve on demand. And we would encourage you to take our learnings and use them in your own way. Oh my God, 40 seconds left.
So that's how we think
Up
about
40
bringing
seconds
compassion,
over.
science, and technology together. It's built on the premise of listening. As patients experience healthcare through the lens of a supportive care provider that takes the time, just an extra second or two, to listen for what we call red flags, it starts to open up an opportunity in which their entire life context is supported with the respect that they deserve. Thank you.